Hey, welcome to The Explainer. Today, we're diving into a true unsung hero of modern medicine, a powerful antibiotic you've probably encountered without ever knowing its name, cefazolin. I mean, really, think about it. You're in that pre-op room, a nurse hangs up a bag of clear liquid. It's just standard procedure, right? But what's actually in there? What's its mission? Well, chances are you're meeting cefazolin. For decades, this antibiotic has been the silent guardian, the frontline protector standing watch to keep patients safe when they are at their most vulnerable. So let's really dig into its main job as the surgical guardian. Cefazolin is part of a class called first-generation cephalosporins. Now that sounds a little technical, but just think of it as one of the originals, a tried-and-true workhorse in the medical world whose primary job is one of the most important out there. And you can see it has a pretty impressive resume. But that first one on the list, surgical prophylaxis, that's its #1 mission. And that's just a fancy way of saying they give you the antibiotic before an incision is even made. It's all about preventing an infection before it can even get started. Beyond that, it's also a go-to for treating things like skin, bone, and joint infections. But, to be a good guardian, you have to know how to fight. And that brings us to cefazolin's secret weapon, its whole strategy as the cell wall saboteur. First, you've got to understand this key term, bactericidal. See, this isn't a drug that just kind of slows bacteria down or puts them in timeout. No way. Cefazolin is designed to actively kill them, to eliminate the threat for good. And its attack plan is just brilliantly precise. It's a 4-step strike. First, it targets specific proteins in the bacterial cell wall. Then, it completely disrupts the wall's construction. Think of it like someone stealing the mortar while you're trying to build a brick wall. The drug stops production of this critical material called peptidoglycan. With the mortar gone, the wall gets incredibly weak. And finally, the bacterium's own internal pressure becomes its doom. It just swells up and bursts from the inside out. A perfect takedown. But cefazolin isn't a sledgehammer. It's more like a sniper. It's a specialist with a very specific hit list. And understanding who it can take down and who it can't is absolutely crucial. It really shines against a class of bacteria we call gram-positives. You can see its strengths over on the left, common troublemakers like Staph aureus and Streptococcus. But over on the right, you see its limitations. It's famously not effective against the superbug MRSA or other really tough opponents like Pseudomonas. It knows its job and sticks to it. And really, this is the whole ballgame. Its prime target is MSSA, or methicillin-sensitive Staph aureus. Why is that so important? Because this is one of the most common germs behind surgical site and skin infections, which is exactly why cefazolin is the perfect guardian for that job. Okay, so we know what it does. Now let's follow cefazolin on its one-way trip through the body to see what happens after it's administered. So here's the itinerary. First, it has to be injected. You can't just take it as a pill. Once it's in, it travels really well to places like bone and joints, which is perfect for orthopedic surgery. But it does have a key weakness. It can't get into the fluid around your brain and spine, so it's useless for something like meningitis. And finally, it makes a really clean exit, taken care of almost entirely by the kidneys. And it works pretty fast. This number here, that's its half-life. It's the time it takes for half of the drug to be cleared from the body. For someone with healthy kidneys, that's only about an hour and a half to 2 hours. This means timing that dose, especially for surgery, is absolutely critical. And since the kidneys do all the heavy lifting to get this drug out of your system, their health is a huge factor. It's non-negotiable. For patients who have kidney problems, the dose has to be lowered. Otherwise, the drug can build up to dangerous levels. It's a perfect reminder of how important personalized medicine really is. All right, but even the most reliable hero has a kryptonite, right? There are limits. Which brings us to our last section, the cautions and potential cross-reactions we have to be aware of. This is probably the most common question that ever comes up with this drug. Cefazolin and penicillin are structurally related. They're kind of like chemical cousins. So what does a penicillin allergy mean if you need cefazolin? Well, the risk really depends on how severe that past reaction was. If somebody had a mild skin rash from penicillin, doctors will often decide that cefazolin is safe enough to use, just with caution. But, and this is a big one, if the reaction was severe, like anaphylaxis, where breathing is affected, then cefazolin is what we call contraindicated. It's a medical no-go. It absolutely should not be used. And while it's usually very well tolerated, there are, of course, other potential side effects. Most are on the milder side, things like nausea or some pain and irritation at the injection site. More rarely, it can affect the liver, kidneys, or even blood cell counts, which is exactly why patients are always monitored so closely.
So we end on this thought. Cefazolin isn't new, it isn't flashy. It's a tool that was developed back in the 1960s, and yet it's still an irreplaceable cornerstone of medicine. And a big reason for that is its focused, predictable nature. It does its job with incredible reliability and a great safety profile. Its story kind of leaves us with a question, right? In an age of constant innovation, what does the resilience of a simple, effective tool like Cefazolin teach us about what truly matters in progress?